breaking the wall to neurohealth education in vulnerable populations. Kelechi Ezeudensi, Neuro-G Project, Nigeria.
Are you aware that neurohealth illiteracy could traumatize the brain of a child and cause some functional abnormalities? Well, the good news is this brain, although I cannot pick them again, but this brain can still heal. Ask me how. By engaging the brain to learn about the brain. Imagine a child who had recurrent febrile convulsions, and instead of taking her to a hospital, she was assumed to be attacked by some wild animals, and then taken to a herbal home where they use all of these things to manage her for years. Now, if this child manages to survive, what do you think will become of this child? Well, what if I told you again that this child was later exposed to some emotional traumatic events? Now, that wasn't a fairy story. That child was me. This left me with severe hypersensitivity, anxiety, depression, and a lot more that I didn't even understand. And then, in a bid to trying to understand the situation, that was what led me to becoming a clinical neurophysiologist. And then as I practiced over the years, my colleagues and I continued to see many patients report very late to the hospital. Most times, many patients with similar events report very late to the hospital, most times after some complications. And so we realized that beside medical treatment, education on neurohealth was very crucial, and hence the birth of Neuro-G Club. Neuro-G Club is a neurohealth education club for vulnerable teenagers in remote areas in Nigeria. We are on a mission towards identifying those teenagers who are struggling with neurohealth challenges, who are being stigmatized, misconceived, mismanaged, and even facing some form of abuse. And we help them heal through engaging them in neurohealth education, connecting them to the right professional, and then modifying their immediate environment by also engaging their peers in the same level of education so as to ensure their inclusion and wide acceptance of their neurodiversities. So we do this in three major ways. Structured neurohealth education classes. Here we teach them the basic structures of the brain, the functions of each of the structures, the interference of abnormalities to those functions, and how this affects our daily living. We teach them stigmatization, misconceptions around those things, and then lastly, the proper ways of managing those disorders. And then again, we have school exhibitions. This is where they work in subgroups to be able to conceptualize a visual representation of what they learned in class and be able to present it publicly during their major school events like parents-teachers events. And then lastly, we have neurohealth excursion. So here, we partner with existing neurohealth professionals, and then they get to have this is an opportunity for them to get to have one-on-one interaction with the students. And so they don't see them as being weird. They could actually have a friendly discussion with them. Impact. So we have a good number of impact, but let me tell you the story. This is Naza. As you can see, she has Pfeiffer syndrome. As you can see from the picture, she has distinct facial characteristics and some limb abnormalities. Before now, she wouldn't be here with her fellow students. She faced a great deal of stigmatization and some misconception and some discriminations as well. But then thanks to Neuro-G Club, that now she can freely associate with others. She feels this sense of welcome and inclusion, and then she happily jumps at even interviews at every given time. Again, we have Ruth. Her picture is not here anyway. She had childhood traumatic events and abuse. And then in her words, that made her damaged and talked to her shell. She struggled with self-worth. Thanks to Neuro-G Club again, that helped her heal, that helped her connect her to the right professional. Today, she's gradually healing. And not just healing, she's coming out gradually to live to the best of her ability. And then the learning. we actually had a widespread. But then we started with having a widespread. But because of the limited finance resources that we had, after careful evaluations, we decided to take it one step. We consolidate on that step. One school at a time. We take up we started with one school, consolidating on that school, and then be able to model the structure to the rest of the schools. Now, if I will conclude with this, if I, Kelechi, could heal to the point of standing on this fallen world's global stage, we will take all it takes to make sure that all the teenagers that are vulnerable, having these challenges, will be able to heal. Nelson Mandela says something. Education is a powerful weapon with which we can change the world. Thank you.
Very powerful presentation. Thank you for that. So you say that there's a very deep-rooted misconception about these neurological problems in communities in Nigeria. So you're working with the children or adolescents, but then we need the parents to be taking them to these health services. What are you doing about the problems with the parents with deep-rooted problems or misconceptions?
Okay, thank you very much. So I didn't say in the presentation that Neuro-G Club is a school. We decided to adopt the club system to make it more engaging. So we partner with schools. So there's schools in the rural communities. So now this Neuro-G Club is a school, is an academic school in those, academic club, sorry, in those schools. So then the school exhibition that I talked about is an opportunity for them to get to engage with the parents and other people. So they have like cultural events, parents, teachers, what they call parents, teachers events. So during those events, these children, we get to present all they've learned. And so that is a way of passing, as well, extending this education to the parents.
Do you also work with, and this is an assumption I'm making, are there health professionals in the schools as well, like nurses and other people who handle those kinds of issues? Do you work with them as part of your ecosystem and thinking about this from a sustainability perspective?
Okay, thank you very much. I think I said it during the presentation that we partner with neurohealth professionals. So that's neurohealth excursion. First is the neurohealth excursion. So that is the time we take them to hospitals, already established neurohealth hospitals. And then, so we're consisting of neurologists, neurosurgeons, clinical neurophysiologists like myself, and so many other neuropsychologists and all of that. So they get to have one-on-one interaction. So they go as an excursion, fun, so to speak, but then these professionals use the opportunity to pass the message across to them, and they get to have like one-on-one meeting with them. And because before now, like a lot of them think like meeting these neurohealth professionals will have to be when you have one big disease or cancer or something like that. So, but with this excursion, it helps them like see them as friends, understand more about, interact more with them, and they get to understand their challenges, and we take it off from there. Again, in schools in those remote areas, most times they do not really have, so to speak, qualified neurohealth professionals. So what we do is we partner with the teachers, and then for people that have maybe G and C sections, so we partner with them to be able to drive these things home.
I wanted to just clarify, because I haven't heard the term neurohealth before. I've heard people talking about mental health, but are they the same things or are they subcategories? Can you
Thank you so much for that. So neurohealth includes, we have neurobiological disorders and we have mental health. So the two together makes neurohealth. So when you talk about neurobiological disorders, talk about like epilepsy, that's seizures that I had. I didn't have epilepsy, but I had febrile convulsions. So we talk about epilepsy, stroke, all of the things we know. And then the other side of it is the mental health, when you talk about depression, anxiety, and all whatnot.
Thank you. Thank you.